Before you book that surgery, pause. Spaying or neutering can protect a dog, but the timing deserves more thought than a single birthday. Some owners hear 6 months. Others hear 1 year, 2 years, or never. The confusing part is that every answer can sound absolute. Modern veterinary guidance is moving away from one rule for every dog and toward decisions based on the individual patient. For females, spaying usually means removing the ovaries, sometimes together with the uterus, so pregnancy and heat cycles no longer occur. For males, neutering or castration usually means removing the testicles, which ends fertility and greatly reduces testosterone production. Other procedures can preserve hormones while preventing reproduction, but availability, long-term follow-up, and suitability vary by dog and location. The clearest benefit is population control. Sterilization prevents accidental litters that families may be unprepared to raise or place responsibly. That matters even for careful owners, because one open door, damaged fence, or brief escape can be enough for an unplanned mating. For an intact female, every heat cycle requires strict management, secure separation from males, and careful monitoring for several weeks. Spaying also prevents pyometra when the ovaries and uterus are removed. Pyometra is a serious uterine infection that can become life-threatening. Warning signs can include lethargy, poor appetite, vomiting, increased thirst, abdominal enlargement, or vaginal discharge. But a closed infection may show no discharge. Because pyometra often needs emergency treatment, preventing the disease can be one of the strongest medical reasons to spay a non-breeding female. Removing the ovaries also eliminates ovarian cancer risk, and removing the uterus prevents diseases that arise from that organ. Mammary tumors are more complicated. Spaying is associated with lower risk, especially when performed before repeated heat cycles. That is why many small female dogs have traditionally been spayed before the first heat, often around 5 or 6 months. But the famous exact percentages repeated online come mostly from older observational research, so they should not be treated like guarantees. In males, removing the testicles eliminates the possibility of future testicular cancer because the tissue where that cancer develops is gone. This is especially important when one or both testicles never descended, because retained testicles carry higher risks of tumors and torsion. Neutering also greatly reduces benign prostatic hyperplasia, a hormone-driven enlargement that becomes extremely common in older intact male dogs. An enlarged prostate may cause blood in urine, discharge, straining to defecate, or repeated urinary problems, although some dogs show no obvious signs. Reducing prostate enlargement can also help manage chronic prostatitis, but infection still requires proper veterinary diagnosis and treatment. One crucial correction: neutering does not prevent canine prostate cancer. It helps benign enlargement, not every disease involving the prostate. Hormone-dependent perianal adenomas are another condition that may shrink or become less likely after castration, especially in older intact males. Then there is behavior, where expectations often become unrealistic. Sterilization changes hormones, but it does not rewrite a dog's entire personality. It may reduce roaming driven by the search for a mate, especially when that pattern has not already become a strong learned habit. Urine marking, mounting, and some hormone-related conflict may improve, but results differ widely between individuals and environments. Aggression is not one simple hormone problem. Fear, pain, guarding, frustration, genetics, and learning can all produce aggressive behavior. A fearful dog will not automatically become confident after surgery, and a poorly socialized dog still needs careful training and support. Think of neutering as one medical and reproductive decision, not a substitute for enrichment, exercise, management, or behavior work. Like any surgery, spaying and neutering involve anesthesia, bleeding, infection, swelling, pain, and recovery risks, even though serious complications are uncommon. A preoperative examination may include blood work or additional tests based on age, breed, medications, and existing health problems. Good pain control, temperature support, sterile technique, and clear home care instructions are part of responsible surgery, not optional extras. Most dogs need restricted activity, incision protection, and daily observation during recovery, even when they feel energetic after only a few days. After sterilization, calorie needs may decrease and appetite may rise. Without portion adjustments, weight gain can happen surprisingly quickly. For dachshunds, weight control is especially important because extra body mass places more mechanical stress on a long, vulnerable spine. Some spayed females develop urinary incontinence, and risk appears to vary with body size, breed, and possibly the age of surgery. Orthopedic concerns matter most in larger dogs, whose growth plates close later and whose joints may be more sensitive to very early hormone removal. For many large breeds, veterinarians may recommend waiting until growth is complete, often somewhere between 9 and 15 months, sometimes longer. Cancer research adds another layer. Sterilization can lower some reproductive cancers while associations with other cancers vary by breed, sex, and timing. That does not mean surgery causes cancer in every dog. Most studies find associations, and different breeds show very different patterns. Dachshunds deserve special attention because intervertebral disc disease is already a major breed risk, independent of neuter status. One retrospective owner survey study reported higher disc herniation risk in dachshunds neutered before 12 months, particularly in females. A separate UC Davis veterinary record study did not find an evident increase in dachshund disc disease with neutering at any studied age. These conflicting results show why retrospective studies cannot prove cause and why one paper should never become a universal command. For a dachshund, it is reasonable to ask whether waiting until around 12 months fits the dog's sex, health, home, and pregnancy risk. For many small dogs generally, older guidelines often suggested about 6 months, with females sometimes scheduled before the first heat. For a female, delaying surgery may preserve hormones longer, but it also means managing heat cycles, pregnancy risk, and ongoing pyometra exposure. For a male, the decision may balance growth, behavior, testicular health, prostate health, and the ability to prevent accidental breeding. For large and giant breeds, the discussion usually shifts later because skeletal maturity takes longer and orthopedic trade-offs carry more weight. Shelter dogs may be sterilized earlier because preventing another unwanted litter can outweigh theoretical timing advantages in an uncertain future home. A retained testicle, uterine disease, repeated false pregnancy, or another medical problem may make earlier intervention more urgent. Heart disease, clotting problems, obesity, active infection, or other conditions may change the anesthetic plan or require postponement. Your ability to prevent mating matters too. An intact dog in a secure, supervised home faces a different risk than a frequent escape artist. Living with intact dogs of opposite sexes can make one heat cycle a major management challenge, even for experienced families. Ask first, is my dog intended for responsible breeding with health testing, temperament evaluation, and a genuine plan for every puppy? Second, what adult size, breed risks, and growth stage should influence timing for this specific dog? Third, for a female, how will we balance mammary risk, heat management, pyometra prevention, urinary health, and skeletal maturity? Fourth, for a male, are there retained testicles, prostate concerns, roaming, marking, or household circumstances that change the decision? Fifth, what should feeding, exercise, pain control, and recovery look like before the surgery is actually scheduled? Bring those answers to a veterinarian who knows your dog, not just the breed name or an age copied from social media. Do not expect surgery to cure fear, erase training problems, or guarantee protection from every cancer and future disease. Do expect permanent contraception and meaningful protection from several reproductive disorders, with benefits and trade-offs that depend on the individual. After surgery, call the clinic for persistent bleeding, incision opening, severe swelling, repeated vomiting, collapse, breathing trouble, or uncontrolled pain. So, should you spay or neuter? For most non-breeding dogs, it can offer important benefits, but the best age is not one size fits all. The smartest decision is the one that considers sex, breed, size, health, behavior, lifestyle, and your ability to prevent an accidental litter. Choose the timing with your veterinarian, protect your dog after surgery, and remember, informed care is always better than an automatic rule.